Hello everyone. Welcome our visit to a primary health care. For example, we are going to visit a primary health care in Saraya Al Qubba in Cairo. Let's take a tour. This poster shows us the activities of the primary health care facility as it contains a laboratory, pediatric clinic, obs and gynae clinic, maternal and child health services, for example, the antenatal care, the health office where vaccination and documentation, registration, release of the birth or death certificates takes place, a family planning room for counseling and seeking contraceptive methods, dental clinic, pharmacy, family medicine room where family folder are present, and emergency for any emergent conditions. Let's enter the first room. We are going to enter the health office room. The health office room where birth and death certificates are registered and released. This is a form of the birth certificate which is given for free at the first time. This is the form of the death certificate. There are three important issues we have to know about the causes of death. What's called by underlying cause of death, intermediate cause of death, and immediate cause of death. The underlying cause of death, it is the disease or condition that is present before and leading to the intermediate or the immediate cause of death. Also, the underlying cause of death is defined as the disease or injury which initiated the train of morbid events that leading to death. The intermediate cause of death, it is the disease or condition that preceded and caused the immediate cause of death. The immediate cause of death, it is the final disease or injury causing death. For example, here in this slide, a patient had liver cirrhosis, but this patient had died because of cerebral hemorrhage. So, what are the causes of death of this patient? The liver cirrhosis is considered the underlying cause of death, as we found that the patient developed nephritis. Nephritis here is considered the intermediate cause of death, but the patient died due to cerebral hemorrhage. So the cerebral hemorrhage is the immediate cause of death because it is the final disease or injury causing death. So liver cirrhosis is considered the underlying cause of death, nephritis is considered the intermediate cause of death, and cerebral hemorrhage is considered the immediate cause of death. Let's enter another room. We are going to enter the vaccination room. First of all, vaccines are very important, are given to people for protection against different communicable diseases. They are present either in the form of compulsory vaccines, obligatory vaccines that are given to infants and children in the first 2 years of life and recommended by the EPI, Expanded Program of Immunization, or in form of non-obligatory vaccines but also considered important. What is a cold chain? The cold chain, it refers to all personnel and all equipment necessary to keep vaccines safe from the manufacturer to the child. This equipment inside the primary health care consists of the refrigerator, as we see, the ice box, and the vaccine carrier. Here is a refrigerator. What are the vaccines inside the refrigerator? First, we open the door of the refrigerator. We find that freezer here shouldn't contain any vaccine except the polio vaccine, as a polio vaccine isn't damaged by freezing or by ice. And also the freezer should contain ice packs and ice cubes. Here are the shelves of the refrigerator. The first shelf, middle or second shelf, third or bottom shelf. The first shelf or top shelf should contain the MMR vaccine, BCG vaccine, and measles vaccine. The middle shelf should contain DPT, tetanus toxoid, and hepatitis B vaccine. And what is this? This is called the thermometer that check the temperature. The bottom or the lower shelf should only contain bottles of water to keep the temperature at optimum degree. So, what is the optimum temperature of the refrigerator to keep the vaccine safe inside? It should be from 2 Celsius degree to 8 Celsius degree. The temperature should be checked twice daily. One at the beginning of the day and the other at the end of the day. Checked through the thermometer, which is located inside the refrigerator. And then the record are documented in a chart which is sticked on the door of refrigerator. Don't forget to look on the door. The door of the refrigerator is empty. Yes, it shouldn't contain anything. The door is empty. There are rules for keeping vaccines in the refrigerator, as putting ice cubes in the freezer. The freezer should contain only polio vaccines, no other vaccine. The door of refrigerator is empty, no food or drinks in the vaccine refrigerator. The bottom shelf should contain bottles of water to keep the temperature optimum. The temperature should be between 2 to 8 Celsius degree. As we explained before, here is the refrigerator. We open it and we found that the door is empty, yes. The freezer contains only ice packs and oral polio vaccine. The top shelf contains only measles, BCG, MMR vaccine. The middle shelf contains the thermometer and the vaccines, which are DPT, tetanus toxoid, hepatitis B vaccine, and the lower or the bottom shelf contains only bottles of water. The temperature and for record the temperature and ensure that the temperature is optimum between 2 to 8 Celsius. We want to know what happened or what will happen if the electricity turned off. There are some conditions health workers do when the electricity turn it off. When the electricity turned off, the ice packs in the freezer are used and are put inside the refrigerator to keep the temperature and to keep the vaccine safe. Then there are insulated containers where vaccines can be put till the electricity restored. If it is unsure the problem can be corrected in time, vaccines can be transferred to alternative or nearby storage facility to keep it safe. And when the electricity restored, the most important thing to be checked is the temperature. The temperature should be checked and ensure the reading to be in between 2 to 8 Celsius degree. Okay. At 9 months, oral polio vaccine and vitamin A is given. At 12 months, first year of life, oral polio vaccine and MMR are given. At 18 months, it is a booster dose for DPT vaccine and MMR, vitamin A are given. This is the oral polio vaccine. This is the hepatitis B vaccine given as IM intramuscular injection in the upper part of the right thigh. It is a BCG vaccine which is given at birth. Try to think and answer. This is a 6-month baby. Try to guess what is the vaccines taken and where. Yes, 6-month baby should take the oral polio vaccine and the pentavalent vaccine. But here in this picture, we see that this baby is taking the pentavalent vaccine as intramuscular injection in the upper part of the thigh. Here what is called by vaccine vial monitor. Vaccine vial monitor helps the health worker to decide whether or not he needs to throw away a vaccine. This system helps to check for the vaccine validity, if it is valid and can be used, or it become invalid and can't be used. How? By looking to this central area. If this central square is lighter than the surrounding circle, so this vaccine is good and can be used. Here, stage 1, the central square is lighter than the surrounding circle, so the vaccine is good. Stage 2, also the central square is lighter than the surrounding circle, so the vaccine can be used. But here in stage 3, the central square is equal to the surrounding circle. Here the vaccine can't be used. While in stage 4, the central square is darker than the surrounding circle. Here also the vaccine cannot be used. Think, what is the condition of this vaccine? Yes, This vaccine is in a good condition. This vaccine is good and valid and can be used. How do we know? By looking to this square area. It is lighter than the surrounding circle, so it can be used. Let's enter another room. We are going to enter the Well Baby Clinic. The Well Baby Clinic, all infants and children less than or equal 5 years should visit this clinic for clinical examination, growth assessment, immunization, and treatment of any health problem. There are two child health cards. One for the boys, which is blue in color, and one for the girls, which is pink in color. Here, they are measuring weight for the baby and documented and registered in the child health card. This is a growth chart. The growth chart compare each child's measurements with the children of the same gender and age. Each chart has curves or lines that represent growth percentiles. These percentiles serve as a reference for comparison. There are growth standards by the WHO as weight for age, length for age, weight for length, head circumference for age. For example, here it is a blue, so it's for boys. Plotting on y-axis the weight in kilogram and on x-axis the age in years, so it is weight for age. Weight for age. For example, we plot the age of the child and the weight, finding on which curve does it meet. This is also the weight for age chart for males. It is pink in color, so it's for girls. It is also weight for age, as we see on the y-axis the weight in kilogram and on x-axis the age. By plotting age against weight and finding on which curve they will meet, and decide either it is normal if it's on the 0 or overweight, underweight. It is also the weight for age but for females, length or height for age for male, length or height for age for girls. Let's enter another room. We are going to enter the family planning room. The family planning room for counseling, for seeking contraception. So let's see what are the contraceptive methods and how are they offered in the primary health care. This is a tray where all the contraceptive methods are served. All the contraceptive methods are served in one tray to the mother. Oral contraceptive pills are considered method of contraceptive methods. It contains two types: COC, which is the combined oral contraception that contains the two types of hormones, estrogen and progesterone, and POP, progesterone only pills that contain only progesterone hormone. It is a copper IUD, another form of contraception. Male condom, another form of contraception. And injections, either taken monthly or taken every 3 months. All these forms of contraception are serviced to the mother at one time in one tray, and that is called by cafeteria method. Let's enter another room, the family health record or the family folder room. Family folders, it's a family folder room where family folders are located. Family folder room is recorded in a family or in a separate folder, and each disease is coded and is labeled with a color. Now we are going to enter another room, the antenatal care. The antenatal care aiming to achieve at the end of pregnancy a healthy mother and a healthy baby that can be achieved through 4 activities: antenatal visits, immunization by tetanus toxoid during pregnancy, health education during pregnancy, early diagnosis and proper management of at-risk pregnancy. First, the antenatal visits. There is schedule for the antenatal visits as should be once a month in the first 28 weeks, and then every 2 weeks until 36 weeks, and then every week till delivery if everything is normal. So if a woman had 5 antenatal visits to the primary health care during her pregnancy, she is considered to have minimum required antenatal visits. In the first contact, the following activities should be done. First, to confirm the diagnosis of pregnancy by pregnancy test, taking carefully history taking about personal history, family history, past histories, obstetric history, examination like weight and height, teeth inspection, blood pressure measurement, examination of the breast and nipples, examination of the abdomen, examination of pelvis. Investigation should be done like urine examination, blood sample for hemoglobin level, blood grouping, Rh factor, vaccination by the first dose of tetanus toxoid. Then the mother is then registered, and the antenatal care time schedule is prepared in 2 copies, one kept in her file in the health center, and the other should be kept with the mother, and she should be instructed to bring it with her at every antenatal visit. Then we will enter the pharmacy. This is the pharmacy. The following drugs should be available in the pharmacy, like the antibiotics, antitussives, eye drops, antipyretics, antihypertensive drugs, and drugs for diabetes. This is a health education message in the form of poster done by our student and your colleagues in the 4th year. As you see, it targets the people or the patient within the primary health care. The message should be clear, simple, within the same language of the target people, and contain colors, images beside the writing to attract the people or the target people. Thank you and thanks for your visit.